The nursing PhD program at Purdue is exceptional in that it is transdisciplinary in its approach. Students who come to this research-intensive campus will have the opportunity to work with nurse researchers as well as researchers in other disciplines who are interested in the grand challenges of healthcare. Our campus-based PhD program allows for the immersion of a student into the research environment and exposure to experts in other disciplines as they develop their research questions and come to develop the skills it takes to answer these questions. Students who come to the Purdue School of Nursing are going to find a very supportive environment where they are mentored, not only on campus, but also at professional meetings and in learning how to communicate their expertise as a researcher. The vision of the Purdue PhD program is that we will create graduates who can transform the science of healthcare. When we say transforming the science of healthcare, we're talking about building a skill set for a nurse researcher to be at the table with not only individuals from other disciplines, but also individuals who are running and managing healthcare delivery systems.
So one of my primary roles is to really listen intently, especially to folks who come to me with inquiries about the program. I encourage a teleconference or a face-to-face visit where I really listen to what their strengths are, what they're doing at the bedside or as leaders or as nurse scientists already, and I really try to match them with the expertise that we have here in our research faculty. Team science is really important right now for a lot of reasons. Research isn't done in a vacuum or with one discipline or one researcher anymore. Our findings are much more rich, much more impactful when we work as members of a team. In my work, I know, speaking for myself and I know on behalf of a number of my colleagues, I've learned so much from them. Hopefully they've learned from me. We're content experts in different areas. And again, really at the end of the day, what we're trying to do is impact healthcare, impact patient lives, and impact the good that we can do for society. Mentorship is critical, and one of the things we want to do at the School of Nursing, this program, is not just provide one mentor, but two. So have that nurse science, that nursing intelligence, if you will, and then also have a real emphasis on that transdisciplinary team through a secondary mentor who's just as important in terms of guiding that student in their research trajectory, towards their thesis, towards their dissertation. But the mentorship really comes in tandem with our model of being an immersive program and an on-site program. We believe it's a strength for us.
One of the advantages of our program being campus-based is that you get to work side by side with researchers who are out in the community working with a variety of organizations doing research to enhance the health and wellness of our community. One of the opportunities we have here at Purdue for our PhD program is not only do you get to work with nursing faculty, but you can work with faculty in a variety of specialties such as engineering, speech and audiology, and nutrition. And if you're interested in gerontology, we actually have a dual title PhD program where you can get a degree in nursing and a specialization in gerontology, and you will have a dual title degree.
Research is a priority for the college, and so we have very strong research infrastructure support. Our college, I think, is unique in that we bring together researchers who have clinical expertise, basic scientists, and social scientists to do highly interdisciplinary, team-based research to address the grand challenges that face us today. And that, I think, will allow us to immerse these new doctorate students in team-based research to address the grand challenges in healthcare as well.
At Purdue, our vision with this program was to cultivate a spirit of inquiry and build tools for our graduates that will empower them to address some of the most complex problems that we're facing in health and healthcare. By working with transdisciplinary teams, we will bring the best of every discipline to the specific question that we're working on. The idea is that collectively we're better. We want our graduates to be prepared to lead teams that are going to take on these challenges and bring nurses' voices to the table. Nurses have such a unique experience with patients. We are the largest profession. We spend more time one-on-one with people that are in the care delivery system. And by empowering nurses to be researchers and bring that patient voice to the questions that we're asking, I think is going to make the difference in what we can do to change the outcomes for people in our state, in our nation, and across the globe.